Welcome back to the Pulse of St. Louis. You know, a nonprofit organization called Gateway to Hope is doing a remarkable job helping patients diagnosed with breast cancer face the disease and focus on healing. Joining me now, Karen George. She is a Gateway to Hope recipient. Karen Morrison. She is a Gateway to Hope board member and community engagement manager at Barnes Jewish Hospital. Keri Koehler, Gateway to Hope program director, and Katie Manga. She is Gateway to Hope executive director. Thank you all so much for being here. I appreciate it. Karen, let's start with you. Tell me your story, because I feel so inspired by what I've seen and what I've heard about you and your story. Tell me about when you were diagnosed with breast cancer and what was your reaction when you found out?
I was diagnosed February of 2018, right after my sister had passed away from it. At the time, I was at work when they called and told me. It was a mind-blowing thing. I remember putting the phone down, crying, and I hollered out, "Lord, I want to live. I don't want to die." It was a frightful thing because I had to think about my children. So when I got back on the phone, I asked the young lady, what was I supposed to do? And she told me to think it over the weekend, just meditate on what I just heard. And when I got off from work, my doctor called. That's when I knew it was real. So I was afraid. I didn't know what to expect, what to do. In the back of my mind, I just lost my sister from it. So it was frightening. It was a life-changing for me because I didn't know what I was going to expect after the surgery. It was a frightful thing.
Yeah. How did you find out about Gateway to Hope?
A young lady, Shirley Jackson, with Breakfast Club, she gave me Gateway to Hope number, and I contacted them a week after I found out. And from there, I connected with them. Christine was the young lady that I talked with, and I called her, and I was telling her what I was going through, what I just found out. She told me, "Don't worry, Karen, you'll be okay." And I was like, wow, this lady telling me that I'm going to be okay. And in the back of my mind, I was just told I had breast cancer, but I had to think about my children, my family. So when I called, she told me what I needed to do as far as paperwork, what I had, each step, and I did that. And from that day forward, she was with me from the beginning to the end till she retired. And then Keri, she stepped up, and
Wow.
when I say Gateway to Hope was really there because I was worried how I'm gonna take off from work, having a surgery, my finances, I didn't want to lose my house. When I say Gateway to Hope supported me, they supported me.
Wow, Katie, you've got to be feeling very proud to hear this testimony, because that's powerful, what she just said. Tell me about the mission of Gateway to Hope and how the organization got started.
Yeah, so it is very powerful to hear stories like this, and it's a privilege to be able to walk with women like Karen on their journey every day. So Gateway to Hope was started about 15 years ago by a couple of physicians in the St. Louis community. And at the time, they were providing donated care to women who couldn't afford treatment. So they really started the organization because they saw countless women coming into their facilities who had delayed care because of inability to pay. So with the Affordable Care Act, our organization has changed a little bit, and what we provide now is financial assistance as well as supportive services for the duration of treatment. So from the moment you're diagnosed until you're finished with your treatment, whatever that looks like, and for everybody that's different. We'll help you pay for your bills, and we'll also make sure that you have somebody who's there to walk that journey with you every step of the way.
Help pay for bills?
Yes.
Tell me about the
Yes.
bills that you help them with. And I say that because that's so important.
Yeah.
You don't have to worry about any financial responsibilities. You can focus on your health and focus on getting better.
That's absolutely right. We see so many situations where women are really forced to have to make a decision between, do I pay for this life-saving health care, or do I pay to keep my lights on? Do I pay to keep my insurance? So those are the types of bills that we'll pay for. Utilities, rent and mortgage, transportation costs, especially to and from treatment, and then insurance premiums as well. So if you have private insurance, then we'll reimburse those premiums for the duration of treatment.
That is awesome. Keri, that emotional support is significant as well. Tell me about that.
Definitely. I think it often is what resonates with patients like Karen. So I work with an amazing team. Right now we have a team of social workers who are trained to provide that support, emotional education, guidance. We all know the healthcare system can be quite complex. Add health insurance issues. I mean, I think we can all have stories of our own experiences with that, but when you have a diagnosis like cancer, it can be even more complicated, especially when you have loss of job or reduced hours and that sort of thing. But providing that space, that comfortable space to just voice your concerns, your fears, your worries, I think that's really what connects with these individuals and what really makes a difference. So providing that sort of navigation piece with the financial piece really helps them, like you said, focus on treatment, focus on getting better.
And knowing there's someone with you
Yes,
every step of the way.
definitely. Yeah.
That's impressive to me
Yeah.
because I thought it was like one and done.
No,
so
no,
it's like, no,
no.
this is a full journey, Karen?
Yes, it is a full journey.
Yeah.
I'm really proud to be a board member for this incredible organization and the work that Katie and her team are doing. And Barnes-Jewish Hospital is very proud to support organizations like Gateway to Hope that support our mission of creating better access for the patients and the communities that we serve. To one of the points that Katie made, 1 in 8 women will be diagnosed with breast cancer in their lifetime. And in the state of Missouri, 4,000 women every year will require financial support while they are in treatment for breast cancer. So the work that Gateway to Hope is doing is critical and key to their success, to their outcomes, to their wellness in fighting the disease.
Karen, were you surprised by the support you received from Gateway to Hope?
I was.
Yeah.
I was. I'm more of a private person. I don't let a lot of people in. And when they said that they would be there from the beginning to the end, I was surprised.
Yeah.
And they kept their word. That's one thing, they kept their word. It wasn't nothing phony or fake about it. You know, you go through some organizations, they say they'll help you. They help you that one time and that's it. But in your mind as a cancer patient, you want someone to be there to the end because you have questions that don't have answers. So Gateway to Hope was there. They really, when I say they were there, they were there. Even at night, when you have the support during the day, but at the night when I can't sleep and you need answers, they would call. So yeah, I had the support.
What else did they do for you, young lady? This is incredible.
I was surprised. When I say, like she said, the support, all I can say is they were there. They were like a family.
Yeah.
They were like a family, and I thank you, each one of you, for being there for me, because I didn't know what I was going to do.
Yeah. So how are you doing now?
I'm doing a lot better. I just had my last surgery in March, so I'm doing good, just the healing process. I'm enjoying life.
Congratulations, and I'm so glad to hear that and glad to see you. Katie, tell me who is eligible to participate in this program?
Sure. So we have some financial eligibility requirements. Of course, first you have to have received a diagnosis, and so we do ask for verification of that. And then if you make 4.5 times the poverty rate, which for a single individual is $56,000 a year or below, you're eligible for services from Gateway to Hope. So we do go all the way up to that $56,000 a year.
And so how many people are currently participating in your program?
Sure. So this year we will serve about 400 women. Most of them are coming from the St. Louis region, but we do serve across the entire state of Missouri, as well as across the river into southern Illinois.
That is so awesome. I'm looking at Keri. She's like, oh, yeah. So, Keri, you knew I was coming to you, right? You knew I was coming.
Flow. Can't wait. There's a flow.
So I'm just curious, though, how rewarding is it for you to know that you're making such a big difference in the lives of people?
Yeah, Shirley. I mean, I've been there for over 4 years now. When I actually had a change of career, I wanted to go into social work because access to healthcare was a passion of mine, and helping individuals navigate complex issues like chronic illness, that's what I wanted to do. And so Gateway to Hope was sort of a perfect place for me to kind of live out my passion and help the people I wanted to help. And in particular in the St. Louis area, you know, with the health disparities that we see, there's a lot of work to be done. And so I feel so grateful to work at Gateway to Hope, to work with the amazing women every day, but also the amazing colleagues that I have, the board members. It's a very inspiring environment to be in.
Awesome. Karen, I want to touch a little bit about whether we are bridging that gap when we come back. Got to take a break.
Sure.
Stay with us. When we come back, we're going to talk a little bit more about that. Plus, we're going to tell you about an event you don't want to miss. Stay with us. Back in a moment. Welcome back to the Pulse of St. Louis. You know, we need to tell you about a very important event that's coming up. And Katie, why don't you tell us about the gala that's coming up? I got information on the screen right now.
Sure. So October 12th at 6:30 at the Ritz-Carlton, we have our annual fundraiser. It's a great night to come out and celebrate stories like Karen's. Karen will be with us that evening, as well as many of the other women we serve. And we really just use that night to tell the story and raise the critical funds that we need to advance our mission and serve the women that we're serving every day.
And you have an incredible story, and you're doing such a great job in the community. Thank you. Karen, before we go,
Yes.
Are we bridging that gap? Are we making sure that people in the community are getting the help they need?
We are, and it's organizations like Gateway to Hope that are helping with that through their community outreach efforts around education, awareness, the importance of scheduling your annual mammogram. We are also very blessed in St. Louis to have many of our local hospital systems that have mobile mammography van programs. So getting those vans out into the community and helping those women get screened is exactly what's helping.
Perfect. Thank you all so much for being here.
Thank you for
Appreciate
having
it.
us.
Thank you.
Thank you for joining us for the Pulse of St. Louis. I'll see you next time. Did we hit it out?